this is an instant focus group we're going to do. What is the baby in baby steps? You've heard the term baby steps. You probably even used it. Okay. Is that empowering, inspiring, and engaging? That's A. Or is it patronizing, condescending, and a little bit insulting? So let's do an A-B test right now. How many of you think A? Raise your hand on baby steps. Okay. How many think B? Okay. So we need to do a little research on how we label and frame these, because if I say to a patient, I really want you to take baby steps, that actually feels to me a little condescending. It's not inspiring to them. Baby steps? No, I want to take a big leap in improvement. All right, so do you prefer baby steps, we did, or simple steps, small steps, tiny steps, and so on? And I think we have to be very aware of our language, because to the degree that we talk with our patients, our members, and so on about baby steps, we may have an opportunity. But if we're going to talk about small steps, I'm going to present something that is heretical. What if the small steps do not lead to sustained behavior change and ongoing habits? What if? Oh my God. Shall we give up our work? Is it all for naught? Because the holy grail, okay, among behavior change is how do I get people to change, and how do I get them to sustain that change in an ongoing way? Well, I'm going to suggest to you that it's not a complete failure if people change and then they change something else, and then they change something else, and the changes aren't sustained. What do I mean by that? Well, I'm going to tell you a story of Mullah Nasruddin. And Nasruddin is a Middle Eastern teacher, joke figure, everyman, and many stories are told about Nasruddin. Now, in this story, Nasruddin was a smuggler, and a very, very good smuggler. He got richer and richer, and he would cross the border, and the border guards would go nuts. Every time he came across, they would unload his donkey. They would take all the sacks apart. They'd almost strip search him. They'd look in his turban. They could never find out what Nasruddin was smuggling. And years later, he retired, and he was sitting in a small caravanserai, and one of the border guards came in and was sipping tea with him and said, Nasruddin, we know you're a successful smuggler. We never caught you. What were you smuggling? And what did Nasruddin say? Donkeys. Donkeys. And the reason I say that is we really want to change behavior. And we are looking for the jewels and the contraband and the exercise and the diet, addiction, medication adherence, smoking, and so on. And sometimes we so overload behavior change that we miss that where some of the real value is actually in the success and process of changing behavior. Namely, how does behavior affect health? Well, there are direct effects. And yes, we all want our members and patients to exercise more, to follow a diet, smoking, medication adherence, and so on. But there's also indirect effects of successful behavior change, namely enhanced mood and confidence. And in fact, I got started on this because I read a study in 1989 that stuck for me. This was about the Arthritis Self-Management Program by Kate Lorig, and later I got to work with Kate and develop the Chronic Disease Self-Management Program. But the surprising finding is the people who went through this program had improved health outcomes. And when they tried to show the association between changing their behavior and the improved health outcomes, the Stanford statisticians, huge database, came up with, we were able to demonstrate only weak, if any, actually, associations between change in behavior and change in health status. I was blown away by that because my whole focus of my work was trying to get people to change their behavior, and yet health outcome was improving, and it wasn't explained by the behavior change. So you go to the people in the groups and you say, why did you get better? And they said, I felt more confident. I felt more in control. And you go to the people who didn't get better, and they say, it doesn't matter if I change my behavior, I feel hopeless, helpless, and not in control. The primary predictor of the improvement of health status was not the behavior change, but it was feelings of confidence and in control. And since they were at Stanford, and Al Bandura is a psychologist there, it was called self-efficacy. And that's actually some of the earliest studies that were shown of the relationship and importance of self-efficacy with improved health outcomes. So I had the opportunity to work with Kate and the team down there on development of the chronic disease self-management program, which we've actually done a study of disseminating within Kaiser Permanente. And these are lay leaders who get together in small groups. The focus of it is increasing people's sense of confidence and control. I know this is strange. We don't care what behavior they choose to change or work on. It's irrelevant. What we care about is how do we help them identify something they want to change that they care about and break it down into a very small step that they are 70 to 80% confident they can have a success experience with, and then celebrate that success. So, what am I saying? Small steps can lead to sustained health habits like exercise, eating, smoking, preventive care, and that does lead to improved health. However, let's remember that small steps can also create a success experience, or as I've come to call it more recently due to B.J. Fogg's work, success momentum. And that increases confidence, optimism, sense of control, and that itself can improve health outcomes. Does that make sense? But it's very different because I would ask you, what happens when we prescribe failure experiences for our patients and our members? What happens when we set ourselves up for failure experiences ourselves? Well, there is a strong emerging literature as well that shows that just a sense of confidence or a sense of happiness and well-being and positive mood is correlated with better health outcomes. 7 types of evidence are reviewed indicating high subjective well-being, like life satisfaction, optimism, positive emotions, is correlated with better health and longevity. Another example are happier people healthier. During the last 4 weeks, have you been a happy person? Or, all things considered, how satisfied are you with your lives? The answers to those questions actually predicts future health. People with higher satisfaction 2 years later, they report 50% better health than those who are not. And finally, do you know about the Nun Study? I love this. Okay, they studied nuns and the diaries of nuns during their training when they were in their 20s. And then 20, 30, 40 years later, they analyzed those. And the nuns who wrote in their diaries and autobiographies at a young age, they wrote about happiness and joy and hope, had 2.5 less likelihood of dying than their gloomier counterparts. So not only do you get to lead a richer, more enjoyable life and thrive, but you also get to live longer. So behavior does matter. Please do not, I'm going to focus on behavior. Behavior really does matter. But also mind matters and mood matters. And those are ways to also improve behavior. All right, let me just show you how much mind and mood matters. If you look at depressive symptoms, this is sub-threshold depression. People don't even qualify for a diagnosis of depression. It has a bigger impact on physical and social functioning than many of the chronic illnesses that we really focus on and put our attention and resources on. I'm not saying ignore those medical problems, but when people are not thriving and they have this low level of depression, that actually affects their health almost as much or more than many of the chronic illnesses. All right, how do we prescribe confidence and success spreading? Okay, so here's our donkey. And the question is, somebody comes in, they got problems in all those areas, you're going to attack them all at once? Maybe not. There's a wonderful study out of New Zealand in which they encouraged people to exercise. They did not mention any other health or life outcome. They only focused on exercise. And what they found out is when you increase people's confidence in one area, in this case exercise, they noticed that smoking goes down, alcohol goes down, perceived stress, procrastination, and they're eating healthier, they're keeping their appointments, they're studying better, and they can focus better. None of that was mentioned in the intervention. The focus was on increasing self-regulation or a person's sense of confidence in one domain. And I think that there's hope that it can spread to other areas of behavior without ever having to directly address those.